Now, hopes that antibody testing for immunity to COVID-19 could help end lockdown in the UK have now been left in doubt. The World Health Organization has warned there is currently no evidence that the tests show survivors won't catch the disease again. The government has bought 3.5 million what are known as serology tests, which check if someone has had the virus, and they're central to the government's plans to get the country moving again. Well, to discuss this, I'm joined now by Doctor Jonathon Pearson-Stuttard. He's a public health doctor and epidemiologist at Imperial College London and also trustee of the Royal Society of Public Health. Very good afternoon to you. Are you surprised that the World Health Organization is coming out with this warning now?
No, I'm not surprised at all. So and the reason for that is that this is a new virus. And so as with all viruses, we're learning all of the time about the virus. We're learning about the antibodies and the degree of immunity that the antibodies give. So it will take some time, and we'll obviously look to places like China, who had the infection first, to see how that immunity does or doesn't go on. But at the moment, what we can do is look at the SARS virus, for example, from 2003. And the SARS virus and COVID-19 have very similar genetic makeups.
What I'm curious
is that immunity peaked at around...
Sorry, Dr. Stuttard, the line is dropping out a little bit there. What I'm curious about with these antibody tests is there a problem with the reliability of the tests, or is the thinking that the presence of antibodies isn't sufficient to presume that that person then has immunity?
So there are two issues, and they're two different separate ones. So on the tests, as has been well documented, none of the tests that have been tested so far by the government programme in Oxford have found to be effective. None of the tests for antibodies have worked so far. So that's the first thing, and that's why there's this ongoing work, pillar 3 of the government strategy, to find some antibody tests that do work. The second question is, when we do have antibody tests that work, and that means they identify the antibody, does that mean individuals who have those antibodies are immune? And that's the second question. And for that, we can use a lot of work of what we know about viruses like SARS in years gone by, whereby immunity peaked at 2 or 3 months and lasted for around 3 to 4 years. But of course, this scientific knowledge will continue to grow. But the WHO comments today aren't surprising because this is a new virus and because we're yet to find antibody tests that work.
OK, all right, Dr. Pearson-Stuttard, I'm very sorry, but we do need to leave that there. I would have liked to talk to you more, but I need to bring our viewers some breaking news now. But thank you for your time.